Good evening. Good evening, everyone. Let's see here. Good evening. Good evening, everyone. I'm Jean Fletcher. I'm going to give a few minutes or a couple as everyone starts checking in. Let me know where you're coming in from. I'm in Bowie, Maryland right now. I work in Washington, D.C. So let me know where you're coming from. It's so good to be with Nap Nap and the Adolescent Health SIG. All right, Baltimore. Baltimore's in the house. Nice to see you. Excellent. All right, Connecticut. Orlando, Florida. Okay. Oh, Indiana. Excellent. All righty. Uh, I know I'm looking forward to. I went to Nap Nap conference last year, and it was in Orlando, Florida, and that was a wonderful time. And now we're headed to Denver, so that's great. I'm looking forward to going to Denver. I've never been to Denver before. So, all right. Dallas. Okay. Texas is in the house. Big Texas. Excellent. Excellent. Well, it's nice to see everybody tonight. It's nice to see everybody. Uh, Tonight we have an exciting topic. We are going to be talking about the unique healthcare needs of adolescents or teenagers. My favorite population. I see you, Ohio. Okay, so we're going to talk about teenagers. And my name is Jean Fletcher. I'm a pediatric nurse practitioner. I have been practicing for 20 years now and strictly all adolescent health care. So, some younger children, of course, throughout my career. And I've been in nursing for 30 years, actually. So it's hard to believe when you think about it. And my twin is here tonight. Hi, Joan. And I work at Children's Hospital in Washington, D.C., Children's National Hospital in Washington, D.C. I work in adolescent medicine. And I have been, again, practicing for 20 years. I've also been a pediatric mental health specialist since 2017. And mental health has just become my passion, mental health and reproductive health care. And I am presently enrolled at GW University for a postmaster's program for the psychiatric mental health nurse practitioner. And my goal is to continue to provide excellent care to our teenagers and helping them transition to be healthy adults. So tonight we're going to talk about the unique needs of the health of the adolescent and this very vulnerable population, and why it is so crucial that as providers we focus on the adolescent health concerns and optimize healthy development during the transition to adulthood. Now, the most important thing that I can stress to you when caring for your teens is to know your resources. You got to know your resources. And I tell you what, Nap Nap is a great asset filled with excellent resources. I have learned so much through Nap Nap, and I'm so looking forward to the conference in March. And I will actually be presenting with my coworker, Miss Angela Hassler. We're going to be doing a topic on unusual presentations of STIs in the primary care setting. So maybe I'll see y'all there. That would be great. Now, some key points about talking to adolescents. First thing first, we got to be able to communicate with our teens. So it's so important that we listen. We have to take the time and we have to listen. And building that rapport. Sometimes you're not going to get all the information at one visit. So just taking time, building a rapport with your team, that's very important as well. And providing a safe environment for all of our teams. So those are just some pointers. Now, the first thing I want to talk about in our teenagers is growth and development. And so, adolescent is a time of exponential growth, rapid growth, both physically, cognitively, psychosocially. And so, the growth that's occurring, how it affects them, how they're feeling, how they're thinking, how they make their decisions, how they interact with the world around them. So, we know these things and we have to keep that in mind, just the rapid growth. And I always say to my teens, how are you doing? A lot is going on. You're growing, a lot of things are changing rapidly. You're, going through a lot of different changes emotionally, and that's normal. How are you feeling? And they'll look at me and they'll start talking. And the other thing I like to do is I always ask them if they've seen the movie Inside Out because I think Inside Out, the movie, was tremendous in terms of exploring emotions. So, that's just one way that I try to talk to them about the things that they may be experiencing. Now, one thing we know about adolescence, it is a gradual development towards autonomy and individual adult decision making. So that's our goal. We're trying to help them get to that point in adulthood. So it's a crucial time for them. Now, we'll talk briefly about the physical aspect. We know that, growth, um, that our males, they'll grow through growth spurts and females too. But this is the time of growth where pubic hair and body hair is developing for the men, and the development of sperm production, increased muscle mass, and testicular enlargement, which starts about age 11, but it can be earlier, but on average about 11. And for the female development, it's breast development and hormonal changes. So, with that being said, Tanner staging is very important, or what we call sexual maturity rating. This is an important aspect of um, the physical, and it's a means of we have to be discreet when we're examining our teens, um, and inspecting where they are with their puberty. And again, normal age of onset for puberty is anywhere between age of 8 to 13. So a lot of changes are taking place when we see our teens. Alrighty. Now, cognitive changes. Oh, before I go to cognitive, I want to talk about the physical aspect. Of course, reviewing their height and weight and their BMI, that is so important. And it's exciting. It's an exciting time because as the teens grow, they like to know where they are in their growth process, if they're normal. They always like to know if they're normal. So a lot of reassuring sometimes is like really important. And I always like to go through when they come in for their physical, that's one of the first things I do because they're always curious. Well, how tall am I now? Cognitive changes is another aspect of the growth and development, and the way the brain functions um, is something that the brain is definitely going through changes, of course. And we know the frontal lobe is not fully developed until your mid 20s. Um, but this is when our teens start developing an increased capacity for abstraction, greater impulse control, increased capacity to self regulate. But our kids are so stimulated, and it's really important that we help them as they navigate adolescence. And of course, that includes the parents too. Now, emotionally, um, this is where they're processing emotions and stress. So we know that it's really important um, that we really help our teens process their emotions, the experiences that they may have. And so, Eric Erickson, he was one of our most influential theorists on emotional development. And of course, we know the fifth stage of development during the teen years um, is um, exploring identity versus role confusion. So, again, that's why, as providers, it's really important that we're helping our teens as they navigate that. So, of course, the major question is, who am I? Their basic virtue is fidelity, and the important events are social relationships. And this is where a lot of conflict comes in with the parents because some parents may feel that their teens or are not engaging with family activities. They rather be with their friends. And it's really important that we help our families understand, this is normal development. And again, we want to help our teens become independent adults. So this is a part of their development, and it's really important that we help them progress through their development. One thing I wanted to add about cognitive changes, ACEs, we know that adverse childhood experiences can actually affect cognitive development. So, we all know how important the adverse childhood experiences are. And so that's something that we need to assess. And so as we get further into the presentation, the one thing that we will discuss is the anticipatory guidance and, looking at those different factors. So, lastly, before we move on, is morals and values. So, this is where our teens develop their morals compass and develop where they are in their place in the world. So, one thing I like to do with all my well child checks, when they come in for their physical, besides going over their height and weight and other things, we're going to get a good history on our kids. And so, typically, you hear of the HEADS assessment, HEADS, HEADSSS, which stands for home, the education, eating, activities, drugs, sexuality, suicide, and safety. But we're going to do it just slightly different. It encompasses all the HEADS assessment, but we call it SHADES. And SHADES is more of a strength based assessment. It's all the things we include in the HEADS assessment, but we start out with strengths. So we want to know a little bit about our team and what they like to do. Um, where are they in their family? Um, Do they like to, are they creative? And then we focus on those type of strengths before we go through the rest of the psychosocial history. So after we go through strengths, then we start with school. And before it used to be home environment, but the home environment can be a very sensitive topic for some people. Um, and so we kind of start out with school to sort of break the ice for them. So you want to know about their home environment, you want to know about school. And I'm not going to go completely into the psychosocial history, but I just wanted to stress how important it is to do a strength based assessment because one thing we know, because we're primary care providers, we're going to absolutely talk about risk factors and things that we would like them to think about and reducing their risk factors. But it's always great to start out and commending them and their strengths and things that they're great at or things that they're doing well in. So, those are just some things. The importance about the strengths and protective factors, it helps us to see their connectiveness to family and to peers, their community, their school, how they're coping with stress, and their decision making. And these are all important factors to take in consideration when you're doing their physical. And it sounds like a lot of information, but as you progress through your psychosocial history, this can help provide information with your screening tools that you utilize. So now I like to break down the specifics for early, middle, and late adolescence. And what I'm going to try to keep in mind are the specific safety measures that we have to keep in mind. Okay, now for early adolescence, we're talking about basically ages 11 to 14. And the most important aspect of this physical is that we're going to do a depression screening. Now, the depression screening is recommended for all ages, starting at age 12, and is based on the United States Preventive Services Task Force. And what we're going to do is when all of our teens come in for their physical, we're going to have our clinic provides a PHQ-9. Those are the additional questions. And it's a modified teen version of the PHQ-9. You use that ages 12 to 17, and at 18, they don't need the additional questions. You just give them the PHQ-9. And I hope I'm not talking too fast. But with the PHQ-9, it's so important that we assess for depression and other things. And I think that's the important thing about the PHQ-9 because it can highlight that there's some depression going on, but it also may highlight that there's something else going on. For instance, a lack of sleep. If our kids are not sleeping, they usually score a 2 or a 3 for feeling tired or fatigued. And so you want to really assess for that as you're doing your screeners. So for this age group, your PHQ-9, that's going to be very important. That's universal screening, um, hearing and vision, and that's within each age group. So at least once to twice in this age group. However, if my kids are participating in sports, I'm definitely doing hearing and vision, even if it doesn't call for it, because I need to make sure they're able to see on that football field. I need to make sure they're able to hear when they're playing soccer. Of course, we want to do the screening for the social determinants of health. And again, this is a very important factor when it comes to ACEs and adverse childhood events because we know experiences because we know that the higher the number of the score for ACEs and our social determinants can actually predict health factors. Now, I'm in an urban area, and our kids are we deal with a lot of kids who already have chronic health conditions. So that can have an effect on um, their ACE score as well as social determinants. So, these are really important screeners that we have to assess for when you're seeing your teens. And then, of course, your tobacco, alcohol, and drug screening. Now, in a short minute, I will go through some safety measures with all of our kids regarding these factors. But another screener that I like to use is the SBART or your CRAFT, and this can help yield information. Our kids, um, you can take a look on CDC's website. They're getting younger and younger and exploring drugs and alcohol. So it can be as early as 11. So, yes, at 12, it's really important to start talking to your teens about these things. Now, one thing that we haven't really touched on is confidentiality, and teens have the right to confidentiality. Now, my younger teens, 12 and 13, I typically play by hand if when they come in. Sometimes the parents are not used to having to step out of the room. So, again, it's building that rapport and explaining why we do what we do. Because ultimately, we want our kids to have autonomy. We want them to learn to be independent. And these are all important factors to engage as they progress through adolescence. So, my very first visit with a 12-year-old, they may not step out of the room. But again, building that rapport, the goal would be for them to step out and explaining to the parents that this is very normal and is part of development. Our goal is not to keep secrets. However, our teens do have the right to privacy and they do actually open up because a lot of times our teens are just afraid to disappoint their parents or they're afraid to ask questions. And sometimes parents may actually be fearful of things and they get excited or, you know, uh, the fear it interrupts with what they want to say or do. So those are just some things. Some selective screenings that may need to be done would be your anemia screening, dyslipidemia, dyslipidemia if they are overweight, and then of course our HIV and STI screening based on our teens' response if they're sexually active, and you know having a non-judgmental affect is really important, of course, with our teens. Now, for the middle age group, this is basically ages 15 to 17. This is our central focus in high school. So, this is their life high school, academics, sports, clubs, and the arts. Um, this is when teens begin to start working after school or on the weekends. And so time management is going to be really important that we talk to them. How they manage their stress is also going to be really important because as they're trying new things and doing new things, this can cause some stressors in some of our kids. Every single one of my patients get a handout on stress management. And I make sure they know that this is not because they're stressed. This is because it is a normal thing that happens, that stress can occur between managing schoolwork, managing home life, managing peer groups, managing sports, managing work, and it's a lot of responsibility starts to occur. And so I want my teens to be able to manage their stress in a healthy way. And so we talk about different coping mechanisms that can help them as they navigate their life. And I think that's something really important to talk about. Um, Learning how different coping skills, including breathing techniques, can actually help change the way they may be feeling inside. Deep breathing exercise, being involved in activity, um, hydrating, which is so important, adequate sleep. And I always tell my teens if they're not getting adequate sleep, they have to think of themselves as a, cell phone. If our cell phone's not charged, it's not going to work properly. If our body is not charged, it's not going to function properly. So those are just some, things that we talk about. Um, in the middle adolescence, this is where the ability to bounce back from stressors occur and resiliency. So we hope to see this, but be aware that this is the highest risk of age group for mental health problems in our teens. So this age group, you're talking about 15 to 17, this is when anxiety, depression, learning disorders may be picked up. ADHD and ADD, some that were managed in middle school or, can kind of um, exhibit themselves. Some symptoms may exhibit themselves in high school. So, yeah, it can happen. It has happened. So, these are just some things you want to keep in mind. Alrighty. So the priorities for the middle group or middle teens would be addressing the concerns of the teens and the parents. So I definitely want my teens to have their own private time at this in this age group, and I do get pushback occasionally, but most times um, our parents are understanding and they will give us that time alone. So I always like to come together first, talk together, see what concerns the parent may have, the teen may have. Then, when it's time for the physical, I'll have the parent step out, perform the physical, and absolutely at that time discuss any confidential issues that my teen may have. When I am talking about confidential issues, we're talking about sexual health, reproductive health. We're talking about drugs, and we're talking about mood. And the one thing I always like to emphasize is if you tell me you want to hurt yourself or someone else, I must inform your parent. That's something I can't keep confidential. So I always make sure they understand that. Um, Before I break confidentiality, I'm going to let my team know. I have to break confidentiality. So those are just important things, and this is a way of building that rapport with your team. They need to know they can trust you, they can feel safe to disclose things with you, but at the same time, they understand that you have boundaries and that there are times where you'll have to um, break confidentiality. So those are just important things to keep in mind. Of course, depression screening should be done. Now, one thing I do, we always get our depression screen, the PHQ-9, completed at the beginning of our visit. But again, that SHADES assessment actually tells me a lot of information. And sometimes I can do my psychosocial history and already know that PHQ is going to be abnormal or normal. So sometimes I don't look at the PHQ-9 before I go see the patient because I like to get information. I don't want to make a judgment before I go in. Other times, depending on how the schedule's moving, I may have to. So those are just some considerations. Now, and of course, um, other things that you definitely want to do, your dyslipidemia, even if they're within normal weight, it should be done at least once between the ages of 17 and 21. And HIV testing should be done at least once between the ages of 15 to 21 years of age. Now, and of course, with your HIV testing, you want to do that annually if they are sexually active. If they're high risk, you may want to do that more frequently. So it varies. We have unfortunately teens who have um, been in situations where high risk teens. So we have to do our HIV testing a little bit, probably more frequently, like um, 6 months, every 6 months, depending on how many partners they've had. So, with mood regulation, you're looking at anxiety, you're looking at PTSD. One thing I want to, and we're going to get to this at the end, and I think I need to be wrapping up actually, but a lot of our kids have experienced some type of trauma. And, that's something that you want to explore and look at. And one thing we know, anxiety, PTSD, um, if they're engaged in fighting or bullying, um, we know that these things can co occur with substance use, depression, and anxiety. So you really want to take a look at their mood, how they're doing, how they're regulating their mood, and how we can support them. And it's so important that you have resources available, and that's why I stressed that in the beginning, know your resources, because we need to get them linked into care ASAP if they're having some difficulties. With our late adolescents, this is a time of transitioning to adult health care when they turn 21. So, transition is not um, uh, an event, it's a process. So, you really want to get started at about 18 or even sooner. How do you get started? You start talking to them about, do you know how to call and make an appointment if you have questions or concerns and need an appointment? Do you know your insurance? We start getting them ready and thinking about these things and not dependent on their parents. So that's going to be really important transition into adult healthcare. It shouldn't happen when they turn 21 where you're saying, well, where are you going to go for your adult health care? No, we got to get them ready when they're 18 and preparing them. And it can be difficult, especially I have a lot of kids I started seeing when they were 12. And it's so hard. They do not want to leave. And unfortunately, they have to. So, those are just some things. Um, Cervical cancer screening, that starts at age 21. We all know the guidelines have changed. And so pap smears, cervical cancer screening starts at 21. But a lot of my kids, they don't transition till they turn 22. So that's something we should be doing. And we want to make sure all the kids, I didn't talk at all about immunization status, but this is a very important factor. HPV vaccine. They can start as young as 11, or I think even younger now, 9. But, when they come into practice, if they haven't started getting it, we want to make sure they get their HPV vaccine, and we want to make sure we get their cervical cancer screening. So, those are just some important things. Social determinants of health, you want to talk about, so I'm going to get into some specifics. specific safety concerns. Now, NAPNAP has an excellent handout on teen proofing your home. And I love this handout. I love it. It was created by the Pediatric Emergency Room SIG and Adolescent SIG. It is wonderful. Um, so these are important things. I'm going to go over some things briefly. The mental health. You want to talk, these are some basic facts. 1 out of 5 children and adolescents are have a mental health or developmental problem, behavior problem, excuse me. That's 1 out of 5. And this is creating a major public health problem. And this is exactly why I decided to go back and work on my postmasters as a psychiatric mental health practitioner. Because we all know how hard it is to get our kids linked into care. You see a kid, they're depressed, they need to get help, you know, linking them to a therapist because we know that's the gold standard therapy, cognitive therapy. But early detection and evidence based intervention for mental health is critical, and it can prevent serious ongoing adverse events. Okay, so this is so cute. It's so important. I can't stress it enough. Um, we know that the Surgeon General in 2021 had mentioned the fact that we had a youth mental health crisis, which was further exposed by COVID. So we know these things. Substance use, um, marijuana, opioids, alcohol, cigarettes, vaping. Fact: 17% of our teens have taken a prescription drug that was not prescribed to them. Um, Another fact: 7% of our teens sniffed glue, aerosol can, paint, or spray to get high. So that's pretty frightening. These are disturbing statistics. 45% of our teens report use of electric vapor product. And we really don't know the ramifications on our health, how vaping affects the lungs. 63.2% have consumed alcohol, 38.6% have tried marijuana at least once, and 32.3% have smoked cigarettes. So I mentioned SBIRT, the Screening, Brief Intervention, and Referral to Treatment, SBIRT. This is a screener. It's a model that encourages mental health and substance use screenings um, as a routine preventive service in healthcare. So take a look at that. That's really important. And lastly, the leading cause of death among adolescents between the ages of 15 to 19. Accidents were number one, unintentional injuries, homicide, and then suicide. And so there's a lot of information, and I apologize for, um, you know, moving really quickly through this, but I can't emphasize how important it is to talk to our teens about safety issues in terms of wearing a seatbelt when they get in the car. If they're a new driver, they are not allowed to have, they should not have many um, passengers in the car that are teenagers. That can be a distraction. No smoking, drinking, driving. Um, that's another problem. No cell phone use. Now, I'm in the urban area, and so a lot of our kids are not driving, but they do get in cars. Someone is driving, so talking to them about making sure that driver hasn't been drinking. That's really important. So a lot of times I just ask them about their safety, if they feel safe. Gun violence is a big problem in Washington, D.C. alone. This year in 2023, uh, there were 92 teens that were shot, and 16 unfortunately were killed. And that's in 2023 alone. gun violence has gone up significantly. And I can tell you, we have teens coming in who were victims of gun violence physically, and then those who have lost loved ones due to gun violence, lost loved ones um, due to other problems. And the other concern that we have is we have teens who may not feel safe to be in school because of gun violence. So these are so many things that we have to help our teens. And so the one thing I always like to talk about is, do you have a weapon? Do you carry a weapon? Um, and that includes knives and other things. Um, do you feel safe at school? Uh, do you feel safe at home? Do you feel safe in your community? And these can be very difficult questions that we ask them because there have been times when they replied no, they do not feel safe at home. And what do you do with that information? Again, these are social determinants of health. We do have social workers, and we try to provide some safety measures and try to, provide some social work um, support for the family. But, I'll give you a brief example. One young man told me he didn't feel safe because their home had been broken in twice in that 1 year. And so, again, talking to them about safety. So, I always stress the importance when they're out and about, not wearing earbuds and making sure that they're not, if they do have them on, you don't want to blast the music. You want to be able to hear, you want to be aware of your surroundings. So, those are just some safety factors that we talk about. Social media um, is a big one, and you all can review the handout that I mentioned. But one of the facts, 15.5% of teens said they felt bullied electronically. And, those are just some safety concerns. And we have to just try to support our families, our teens through this. Um, I'm just going to briefly add about sports medicine. We have a lot of cheerleaders, football players, other sports, and concussions are a big factor. We have sports medicine at our practice, so we definitely get them engaged into our sports medicine doctor, Dr. Coleman. So that's really good. And an article just came out with the AAP talking about overuse injuries, overtraining, and burnout in young athletes. So these are another safety factor that you want to talk about. Lastly, with reproductive health and STIs, HIV, we know that teens are more at risk for getting STIs, and there's a lot of reasons for that. It's not because they're the only ones having sex, but we know that, for instance, the cervix is not fully matured yet, and they're prone to infection. Use of protection, um, birth control is a shared responsibility. It's not just the females we should be talking to, we should be talking to our guys as well. And that's really important. Um, you want to talk about violence, if they're feeling safe, um, ask about relationship violence, if they are being treated properly. Um, we know that 10.6% of our teens have been forced into sexual acts by someone they were dating. And, those are some things we really need to talk about and make sure they know they can advocate for themselves, and take care of themselves and feel safe to talk to you or someone they trust is so important. We have to really stress that to them. Um, and most importantly, we want to create a safe space for our teenagers, regardless of sexual orientation, gender identity. We want to embrace all of our teenagers, provide a safe space. A lot of information can occur with your well child check, but it's just the beginning. It's just the beginning. This is where you want to develop your rapport and you want to bring your kids back in for follow up. I'm famous for bringing my kids back in for a follow up, because we know Rome was not built in a day. So we want to establish that relationship and, get that, going so that we can see healthy adults. So I hope if you have any questions, feel free to put it in the chat box. I really appreciate you all being here tonight. It is a lot of information. I love adolescent. It's my passion. Um, and mental health, reproductive health. I hope to see you at the NAPNAP conference. All right. It's a blessing. I'm so thankful to be here tonight. And I hope you all have a blessed evening. Be blessed. Good night.